Hi everyone. Today I would like to answer two very frequently asked questions while giving a consultation to a liposuction patient. These questions are: 1. Will I gain weight again? And number 2, will the treated area accumulate fat again? These two seem to be some of the very common questions that people ask me. So coming to the first one, weight gain, whether it is before liposuction or after liposuction, is always a function of your net calorie intake. That means if you take much more calories than you are spending. For example, if you eat 2000 calories worth of food and spend only 1000 calories that day, the remaining 1000 calories will compulsorily get converted to storage form, that is fat, and this fat will obviously add to your weight. So this is not really related to whether a liposuction has been done or not. Weight gain or weight loss is always a function of your lifestyle and your body, that is net. If you do a net negative calories, that means you eat less and work out more or spend more calories, you lose weight. If you eat more calories and work less, then it is positive, that means you will gain weight. It's as simple as that, and it's not really related to liposuction. Now coming to the second question, will I gain fat in the same area which was treated before? So to understand this, you have to know that fat really cells. Fat is made up of cells, so it is not a substance as such. It is a tissue, living tissue made of fat cells as such. So they are in a certain number in that certain area, and these cells do not really actively replicate much. They increase or decrease in size. When you put on weight, when you put on fat, that means each fat cell does grow in size. And then similarly, when you starve or when you are on a diet, each fat cell reduces in size, thereby grossly decreasing the size of the area. Now in a liposuction, we actually extract this tissue and the cell count in that area, the fat cell count in that area is drastically decreased. So what happens is, after liposuction, should you overeat, you will definitely gain weight, but not so much or not to the previous extent in the area that is treated. This excess weight or excess fat will be diverted elsewhere depending on the genetics, depending on your personal genetics that you got from your parents. You will gain the fat, but not so much in the treated area.